Hi there, Dr. Malka here, your Los Angeles-based chiropractor and acupuncturist. Today I'm going to show you how to relieve hand and finger pain. Whether the pain is from overuse, arthritis, or injury, these general self-treatments can help control pain and help with healing as well. We're going to start off with some massage and then move on to stretches and then exercises. So let's get started. I'm going to put a little bit of lotion on. This is a Soothing Touch massage lotion, or you could just do a combination of oil and lotion. Make sure you mix it up because they do separate. So I'm going to start just by pulling on the fingers, doing a little rotation and pull, a little rotation, massage and pull, working all the fingers and pull. So it's a little bit of traction with massage and pull. And then finally the thumb, massage and pull. And we'll go ahead and do the other hand. I'm going to do this with the palm up. Go ahead and massage and pull. Massage and pull. And if you have one finger that's a little more sensitive than the others, just spend a little more time on it. Massage and pull. And massage and pull. And then to work into the palm area, you generally don't want to massage too much on the top of the hand. That can be a little sensitive, but you can work it into the palm using the thumb and coming in. The fingers are just an extension that come all the way down these bones. Go in between the palm and work into these areas. And again, emphasizing areas that are a little more sensitive for you. Maybe your thumb area is a little more sensitive. Or if you've been typing a lot, sometimes this little area right here where the pinky finger is more sensitive. And then as well, and I'll show it on this hand, if your fingers get tired, you can also come in with your knuckles and do massaging in here like so. And then if you have a Theracane handy, I'm going to show you how to use the Theracane to massage the hands. So these larger areas on either side of the thigh, and then just pull your thighs together to stabilize it. You may want to just hold the Theracane and then just massage one hand at the time. And with the Theracane, you can get in there pretty deep. You can massage your hands for about 5 minutes, or whenever you feel like these areas have been worked out. Continuing with the stretches, we're going to go ahead and stretch each finger one at a time. Stretch it back and then bring it forward. Stretch it back and then bring it forward. Back. And again, if there's one finger that needs a little more stretching than the other, then go ahead and emphasize that. And you can hold it for 10 seconds. 20, 30 seconds, and then back. And then stretch the thumb, and then back. And then continue with the other hand. Stretch, and then come back. So let's say this finger's tight. You can add stretching against resistance. So I'm going to stretch it back, and then I'm going to do a pushing motion. Now the pushing motion, you're not going to change the range of motion. You're just pushing against your other hand. And then back, and then let's say it's this one. I'm going to hold it and then push maybe about 10% of your strength, and then relax and let it open up. And then bring it back and stretch it. And then the other finger, the pointer, push if you want with stretching against resistance. And then come back. And the thumb as well. Stretch it all the way back and then bring it all the way forward. And then because the wrist is such an important part of the hand and the fingers, you can put these one hand like this and then stretch the fingers all the way back. And then go ahead and push against the hand. All the way back, and then push against the hand for 10 or 15 seconds. Just to loosen up the fingers a little more, we can splay the fingers, make a fist. Splay the fingers, and then make a fist. Splay and make a fist. And to improve your tactile ability, you can bring the thumb to the fingers and then the fingers to the thumb. And the other side, thumb to the fingers and fingers to the thumb. And if this is difficult, you have a lack of coordination, perhaps you had a stroke, this is a really good learning tool for coordination. It'll help you with those minute tasks of writing and such. So the next, we're going to go on to exercises. So you want to go ahead and squeeze the balls. Now I'm using tennis balls. You may want to use exercise balls that have a little bit of give. And then relax. And then squeeze for a count of 10. And relax. Try squeezing as hard as you can. But then if it's painful, peel it off back to maybe 50%. And relax. And this is strengthening these areas of the forearm, which also connect into the hands. And they do that gripping. Obviously, I'm gripping the ball. Does the gripping strength. And then finally, the rubber band stretch. So we worked these muscles. It's time to work these muscles. So you can use a stronger rubber band, thicker, or if you don't have a lot of strength, use a smaller rubber band. Open the fingers up and relax. Open the fingers up for a count of 10 and relax. And I'm going to do them at the same time, and you can see the difference because this rubber band's a little harder. See how I can open up this one more? And relax. So all these things you can find around your house. You don't have to buy anything. And relax. Open and relax. And then just shake the fingers out and the wrists. And that concludes how to self-treat your hand and finger pain. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. And I'll be available for any questions you have or suggestions for future videos.